Hi, my name is Reese and this is going to be my skills video on chest tube insertion. So the supplies that I'm going to need for this video are water in order to fill the water suction, and I'm going to need gloves, but I would need sterile gloves if I was handling the insertion part of the tube, which would connect to the patient. And then I have a consent form, which I will go over, and yeah. And then of course I have my chest tube. So before having the chest tube in place, we just want to verify consent because this is a medical procedure that does require consent. So I would want to make sure that the patient is aware of all the risks and all the benefits and why it's placed in, and if they have any more questions prior to insertion. And then I would want to make sure that the patient signs and the doctor signs, and then I would sign as a witness. Okay, I'm going to start off by filling the water sealed chamber. So typically the back would have sterile water that you would put in, but just for the purpose of the simulation, I'm just going to use the syringes that I have filled up here to fill it up. So you're going to want to fill it to the 2 centimeter line. So I'm going to do that. Alright, and so I have the water sealed chamber filled up to the 2 centimeter line. Okay, so I have my chest tube, so I would want to make sure that this is the end that would be hooked up to the patient. And of course I would want to use sterile gloves whenever touching this part, but for the sake of this video, I will not be having any. And then of course I need to get my suction ready. So I would have this tip of the tube hooked up to the suction port right here. And I would want to make sure that all the other caps on top of the suction are closed, otherwise it won't be able to suction properly. And then on the chest tube, it would hook up to the same part where you put the water in. And then in terms of placement of the chest tube, you're going to want to make sure it's placed below the patient to allow gravity to help with the drainage. So it would be placed down below the bed, or you can hook it to the bed rails below. Okay. And then of course this part would still be hooked into the patient. And then you would adjust the suction right here with the wheel. And then this is also to the doctor's order, so for the sake we'll just have it at 20. And then this part right here, it would obviously still have water in it. So you would want to make sure to check for any bubbling. If you see continuous bubbling, that would indicate that there's a leak. So in order to check for leaking in the tube, you would start with this part, which would be inserted into the patient, and you would want to clamp right outside the dressing, because if you clamp and the bubbling stops, that could indicate that there's a leakage somewhere within the insertion site as well. If the bubbling does not stop, you would want to continue to clamp using this to verify and try and find the source of the leaking to indicate if a new system would be needed or if the tubing needs to be replaced. So of course you would want to make sure that the vacuum for the suction is hooked up as well, so that way you can adjust according to what the doctor's orders are as well.